Okay, for any new parent, there are a few things that are just terrifying. And seeing your baby spit up green is right at the top of that list. I mean, it's just a color, right? So why does green vomit send alarm bells ringing for doctors everywhere? Let's break it down. So yeah, what is the big deal? Well, in the medical world, this is called bilious vomiting, and it's a huge red flag. It could mean there's an intestinal blockage. But the real fear, the thing that gets everyone moving so fast, isn't just any blockage. It's one very specific, very scary, and thankfully very rare condition that has literally shaped the emergency response for newborns.
But here's the thing, and this is super important. Not all green is the same green. We're not talking about a little bit of lime green or a yellowish tinge. Nope. The color that really gets doctors' attention, the one that signals true bile, is a really dark, almost spinach-like green. Getting that color right is the first and most critical step in figuring out what's going on.
And that dark green color, it points to one potential culprit that every single doctor is trained to look for and, frankly, to fear. It's a condition called malrotation. And even though it's pretty rare, the consequences of missing it are just catastrophic. And that's created a massive dilemma for the entire healthcare system.
So what exactly is malrotation? Basically, it's a birth defect where the baby's intestines don't get arranged in the right way inside their belly. Now, that alone might not be a problem, but the real danger is that this improperly placed intestine can twist up on itself. That twist is called a volvulus, and it's a nightmare scenario. Think of it like a garden hose getting a kink in it. Nothing can get through, and even worse, the blood supply gets completely cut off. It becomes a life-or-death surgical emergency, and time is absolutely critical.
And this is the key to understanding the whole dilemma. The fear of missing that twist, the volvulus, is so huge that it's led to a default protocol. If a newborn has dark green vomit, the standard move is to immediately transfer them to a major children's hospital with surgeons on standby. It's a better safe than sorry approach. Just in case.
And the scale of this just-in-case approach is, well, it's massive. A big national review in the UK looked at the numbers and found that somewhere between 500 and 600 babies are transferred every single year for this one symptom. That's more than one baby every single day. Just think about that. Hundreds of families, ambulances, transport teams, all mobilized because of the color of a baby's spit up.
The thing is, this transfer everyone first policy, while well-intentioned, causes a whole cascade of problems. A major report uncovered that not every hospital has 24/7 access to the right kind of scan to check for this. It puts a massive strain on the specialized transport teams who have to move these tiny patients. And it needlessly separates mothers and babies, often right after birth. It even means that the quality of care you get can depend on your zip code. It's just not an ideal system.
So all of this led experts to step back and ask a really important question. Is this whole system of automatically transferring hundreds of babies, is it actually necessary? Is it backed up by the evidence? It was time to stop reacting out of fear and start looking at the cold, hard data. And that really boils down to this one question. Out of all those 500 to 600 babies getting transferred every year, how many of them actually have the life-threatening malrotation that everyone is so afraid of?
And the answer was, honestly, pretty surprising. When researchers pulled all the data together, they found that malrotation, the big scary diagnosis, was only present in about 10% of the cases. Okay, so 1 in 10. Another 15% had some other kind of issue that needed surgery, and about 8% just had a bad infection. But here's the kicker. The huge majority, a whopping 2/3 of all these babies who were rushed to surgical centers, they had nothing seriously wrong with them at all.
And this wasn't just a fluke. If you look at a summary of a whole bunch of studies covering over 1,600 babies, the numbers hold up. In total, about a quarter of them do need some kind of surgery. But that dreaded malrotation, it consistently shows up in only about 1 out of every 10 babies. So the data was pretty clear. We could definitely be a lot smarter about how we handled this.
And all of this evidence led to a real breakthrough. A new solution was developed, not based on fear, but on data. It's a clear, logical framework designed to give every baby better, more consistent care, without sending the whole system into a panic every single time.
So the folks who came up with this are called the British Association of Perinatal Medicine, or BAPM for short. And what they created is basically a new roadmap for doctors. It's a standardized pathway that helps them make the right call, ensuring every single baby gets exactly the level of care they need right when they need it.
So how does this new pathway actually work? Well, it's beautifully logical and step-by-step.
Step 1, you do a really thorough initial checkup on the baby. Look them over, check their history, run some basic blood tests, and get a simple belly x-ray. Step 2, you look for any immediate red flags. Is the baby's belly swollen? Does the x-ray look really wrong? If yes, boom, they get an urgent surgical review right away, no delay. But if not, you move to step 3, check for other, less scary causes. Could it just be an infection? If so, you treat that and watch the baby closely. And only if you get through all of that and the baby seems perfectly stable and well, do you move to step 4, arranging for that specialized contrast scan to definitively rule out malrotation. See? It's all about intelligently sorting babies based on risk instead of treating them all like a worst-case scenario from the get-go.
And what's really clever about this framework is that it's not a one-size-fits-all solution. It knows that different babies have different risks. For a healthy full-term baby, yeah, the main thing you're worried about is a blockage like malrotation. But for a tiny preterm baby, there are other serious gut conditions like something called NEC that are actually a much bigger concern. So the framework has a separate, slightly different pathway just for them.
Okay, so we have this new, smarter approach, but what does it actually mean in the real world? Well, the impact for families, for hospitals, and especially for the babies themselves it's just huge.
So why is this such a game changer? Well, for starters, it means every hospital is playing by the same rule book, which makes care more equitable. It drastically cuts down on those stressful and often unnecessary transfers. That means more families get to stay together when it's safe to do so. And here's a really crucial point. When you're not tying up ambulances and transport teams with stable babies, it frees them up to get the truly sick babies, the ones who are in real trouble, to a surgeon even faster. It's a win-win that gives everyone from anxious parents to the medical team the comfort of a clear, logical plan.
And you can really feel this new balanced approach in the way they talk to parents now. This is a quote from the official parent leaflet, and it says, "Most babies remain well and don't have a serious problem, but it is important that your baby is cared for appropriately and is checked to rule out some serious causes." I think that just nails it, right? It's reassuring, hey, your baby is probably fine, but it's also clear and vigilant. It says, we're going to check carefully just to be sure.
When you step back and look at the whole story, it's just an amazing example of what happens when you follow the evidence. It answers that final question, doesn't it? How can a simple flowchart save families from stress and a healthcare system from strain? Well, it's by replacing a system built on fear with one built on data. And in doing so, it protects babies, it spares families a ton of anxiety, and it makes the entire health system work better for everyone.